Hello, everyone. I'm pretty sure it's Monday, so happy Monday. So this starts our focus week where we are going to be talking about spaying and neutering and some other things along those lines. And each day will be a different focus. Today's focus is on options for male dogs. We are going to have a day that is specifically dedicated to kitty cats. So don't worry, kitty cat people, we're going to get you in there too. So today, we want to talk about sterilization options for male dogs because in the United States, the overwhelming majority of companion dogs are sterilized, either spayed or neutered, and most of them before 1 year of age. And we want to take a closer look at this and open your eyes and your minds to maybe we've been doing this wrong for a really long time because in countries in Europe, there are many countries where dogs are not automatically sterilized. And we are going to give you a lot of proof as to why that might be a better option and other ways that we can look at this. So, neutering in the United States, unfortunately, has been really critical for population control. And I'm going to pin that one on pet owners who are not responsible for their intact animals. And most pet parents and some veterinarians assume that there is only one, actually, I'm going to go with most veterinarians, assume there's only one method for sterilization of male dogs. And there are several methods, but there's only two that I recommend. So the first one that we want to talk about is the traditional neuter or castration. And with the castration, it's the most common sterilization procedure in the United States for male dogs. The testes or gonads of the dog are completely removed. So they're taken out of the scrotal sac, they're taken out, discarded, removed from the body. And so any surgery that removes the gonads changes the animal in both positive and negative ways, and we're going to talk about those. Um, so we have mounting evidence that supporting the long-term health complications associated with surgical sterilization with testes removal is going to require a little bit of different thinking. Gonads are not just reproductive organs, they are necessary endocrine glands for normal metabolic, behavioral, musculoskeletal, and anti-cancer effects. We're going to talk about each of those a little more in depth. So the other option, rather than a traditional neuter for sterilization, is a vasectomy. And with the vasectomy, it's a less invasive procedure, and it's still performed under general anesthesia. And it involves cutting or tying the vas deferens, which is the tube that transports the sperm from the testes to the outside of the body. Wow, this is like birds and the bees 101. But the testes remain intact, but the dog is rendered infertile because the sperm can't be released. The surgery can be performed on pediatric patients without interfering with their maturation. So that's a good thing, particularly for shelters or rescue organizations that want to get male puppies adopted out sooner than waiting for them to reach maturity before going through a traditional neuter. Unfortunately, this is not taught in, I'm going to go with all the veterinary schools, but maybe there's one out there. If somebody knows of one of the veterinary colleges who's teaching a vasectomy, let us know, because there are very few veterinarians who know how to do this. But keeping the sex hormones intact will significantly reduce the risk of a lot of things that we're going to talk about in the next few minutes. So vasectomy is not effective right away. So you want to prevent them from having contact with intact females for a couple of months after the procedure is done. There is, with males that are either left intact or still have the testes and the hormones there, there's an increased risk of what we call perineal hernias, which is a hernia out the backside of the dog, and a little bit higher risk for inguinal hernias, which are in the groin, and a higher risk for perineal adenomas, which are small tumors that form around the anal area. Generally, when those if one of those problems occurs in our older male dogs, we will go ahead and castrate them to reduce testosterone release at that time. But these generally are not that big a problem. And we're going to talk about some other things that might be bigger problems that are going to factor into your decision about what to do with your male dog. And then behavioral concerns, although with a vasectomy, the dog will be infertile, he will definitely still be attracted to females in heat because he's still got all those hormones there. So that's going to require training on your part. But there are certainly many intact male dogs who do not have bad behavior around other dogs. So let's talk about some of the reasons. And then your third option is to leave them intact, which is what I've done at this point with Forrest, because there are a lot of good reasons for that. All right. So I'm going to read through some things from some studies. Prostate cancer has been reported to occur more commonly in neutered than intact male dogs. And this is one of those myths that is perpetuated by a lot of veterinarians as one of the reasons why you should neuter your male dog. They tell you, oh, he's going to have a higher risk of prostate and testicular cancer. Okay, well, prostate cancer, we just busted that myth. All the studies are saying, no, really, prostate cancer is more common in neutered male dogs. As far as testicular cancers, most of them are not malignant tumors, but they are hormone-producing tumors. And they're generally in only one of the testes and generally solved by castration if it does occur. Now, you might argue that, well, now I'm putting my older dog under anesthesia to have a castration done. Maybe he's not going to be as well equipped to handle the anesthetic. Maybe, maybe not. And maybe he'll never develop these problems. But we're going to talk about a lot of other things that can happen when they are neutered. Okay. So the data that I'm talking about were derived from recorded visits to North American veterinary teaching hospitals. And they did an analysis of the databases looking at a bunch of different cancers and whether they were more common in neutered or intact males. And what they found, neutered males had a 3.56 times greater chance of developing transitional cell carcinoma of the bladder than neutered males had a significantly increased risk, 3.5 times more than intact. So leaving them intact is going to protect them from transitional cell carcinoma. For prostate transitional cell carcinoma, it was 8 times more common in the neutered than the unneutered. 2 times more common to have prostate adenocarcinoma, and 3.86 times more common for prostate carcinoma, and 2.84 times more common for all prostate cancer in neutered versus unneutered. So intact males have a much lower chance of developing these prostate cancers and transitional cell carcinomas. So when your veterinarian is saying, no, we're going to prevent prostate cancer, you can say, not really, not really. Let's see. And there was some breed predisposition that they saw, and they didn't list the breeds in this particular outline that I have here, but do suggest that some genetic factors play a role in the development of prostate cancer as well. So another thing that we see, so consider that the testes or gonads are just one endocrine gland in the entire endocrine gland system in the body. So we've got a lot of other endocrine glands that also play into this system. Hypothyroidism, so low thyroid function, is correlated with neutering in both sexes because it's associated with autoantibody expression against the thyroid. So we see autoimmune thyroiditis more common in neutered dogs. And this is one of those things, if you decide to delay neutering, but then in middle age decide to go ahead and neuter your male, my recommendation with my clients and what I would recommend for all of you is that over the next year, monitor the thyroid function. Monitor it 3 months, 6 months, 9 months, 12 months, because it's probably going to drop. It's probably going to bottom out at some point. So you definitely want to look at that, because that's one of the reasons that we get this decreased metabolism and obesity and a lot of other secondary problems. Okay, so this is another study that came out in 2020. So these are fairly new studies. We're not looking at ancient information here. For some dog breeds, neutering may be associated with increased risks of debilitating joint problems and some cancers. And I've got multiple studies here that we're going to talk through. There were major breed differences in vulnerability to neutering, both with regard to joint disorders and cancers. So some of these things we find are a bigger problem in the large breed dogs than they are in the small breed dogs. The small dog breeds seem to have no increased risks of joint disorders associated with neutering. And in 2 small breeds, the Boston Terrier and the Shih Tzu, there was a significant increase in cancer. Significant increase in cancer in Shih Tzu and Boston Terrier with neutering the males. Several investigations have revealed that joint disorders and some cancers may increase in association with neutering. One found that hip dysplasia and cranial cruciate ligament tears or ruptures were significantly more likely in neutered than intact males and females. I have that study, I'll get to it. Another study found that neutering was associated with a 3-fold increase in excessive tibial plateau angle, that's in the stifle joint. And that is a risk factor for development of cranial cruciate ligament tears or rupture. And we believe the reason behind this is that when you neuter before they reach maturity and their bones are still growing, the bone growth plates will stay open longer. The longer they stay open, the longer the long bones continue to grow. So we see increased elbow dysplasia, increased hip dysplasia, this change in the angle in the stifle joint, and more cruciate ruptures. And it's because those long bones keep growing and push themselves out of the hip socket, out of the elbow socket. And that's why it's a bigger problem in the large breeds, because they have more length change in the bone. Neutering is reported to be a risk factor for canine intervertebral disc herniation in dachshunds. So these long-backed breeds, the corgis, the dachshunds, neutering is going to increase the chances for disc problems. Certain cancers are also known to be more likely in neutered than intact dogs, and we'll talk about those. Neutered male and female were more likely to die of cancer than intact dogs. And reports from the Golden Retriever Lifetime Project is that neutering at less than 6 months of age increases the risk of cranial cruciate ligament injury. No shock. In Labrador Retrievers, Golden Retrievers, and German Shepherds, there was an increase in the incidence of 1 or more of the joint disorders when neutering in the first year, at an incidence of 2 to 4 times more than what we see in intact dogs. All right. Okay. So there is evidence that less exposure to sex hormones, this is another study, increases risk for other aggressive cancers, including osteosarcoma, bladder transitional cell carcinoma, we just talked about, prostate cancer, lymphoma, and mast cell tumors. So sex hormones may not be all bad. Duh. And they may be protective against certain cancers. Osteosarcoma is the most common bone cancer in dogs, accounting for 85% of bone cancer cases. It is very aggressive, and 90% of patients will die from spread of the disease within the first year, when amputation is the only treatment. Purebred dogs who have been spayed or neutered are twice as likely to develop osteosarcoma. The risk is even higher for Rottweilers. One study looked at 683 Rotties and showed that both male and female Rotties who were surgically sterilized before the age of 1 year had an approximately 1 in 4 risk, 25% of these dogs, of developing osteosarcoma during their lifetime, while intact Rotties were much less likely to develop the disease. Spayed and neutered Rotties were 4 times more likely to develop osteosarcoma. All right, prostate cancer. Neutered males were 4 times more at risk for prostate cancer than intact males. A second study showed castration increases the risk for developing a bladder and prostate cancers by 3 to 4 times. The greatest risk was for prostate transitional cell carcinoma with an overall risk factor of 8. Lymphoma. Spaying has been shown to increase the risk of lymphoma. Oh, sorry, that's a Tuesday thing. Here's an interesting factoid, though. In people, women have a lower risk for lymphoma than men. Estrogen's protective. We'll talk about that tomorrow. For all types of heart tumors, castrated males were at a greater risk than that of intact males. All right, this is the study of golden retrievers, 759 golden retrievers. Veterinary hospitals were looked at, and they were classified as intact, neutered early, which is before 12 months old, which that's kind of weird to call that early because a lot of these dogs are getting neutered at 6 months, and some of them even as young as 6, 8, and 10 weeks. And then they consider neutered late greater than 12 months. For hip dysplasia of the early neutered males, so less than 12 months, 10% of them were diagnosed with hip dysplasia, which was 2 times the occurrence of intact males. Cranial cruciate ligament tear. There were no cases of cranial cruciate ligament tears in intact dogs, but there was 5% incidence in early neutered males. So that's 5 out of every 100 dogs. For lymphoma, almost 10% of early neutered males were diagnosed with lymphosarcoma, which is 3 times more than intact males. They did not find lymphosarcoma cases in late neutered males, so even having those hormones for the first year did offer some protective effect. The disease rates for all 5 diseases analyzed in this particular study, the disease rates in males and or females were significantly increased when neutered was performed early and or late. When a disease occurred in intact dogs, the occurrence was typically 1/4 to 1/2 that of early or late neutered dogs. Okay. All right, Joey, I think I need the other slide. That one. Yeah, no, that one. Yeah. Okay. So this was a study of greater than 90,000 records looked at from the University of Davis Veterinary School over a 15-year period. And looking at neutered versus intact dogs, they found significantly greater risk of the following immune-mediated diseases: atopic dermatitis, autoimmune hemolytic anemia, myasthenia gravis, colitis, Addison's, which is hypoadrenocorticism, hypothyroidism, immune-mediated polyarthritis, immune-mediated thrombocytopenia, inflammatory bowel disease, lupus, and pemphigus. Data underscore the importance of sex steroids on immune function, emphasizing a role of these hormones on tissue self-recognition. Immune system tissues, the thymus, lymph nodes, spleen, have gonadal steroid receptors. So the immune system counts on these hormones as part of the immune system function. Androgens, which are the male hormones, are immunosuppressors, and we lose that with neutering. So we see more autoimmune disease because the immune system is overreacting. Okay, that's for Tuesday. All right, and then we don't have a slide for this for Facebook. So there was a study looking at aggression toward familiar people, strangers, and other aggression in neutered versus intact dogs. So this is another reason why your veterinarians will tell you to neuter your dog. Oh, he'll be much less aggressive if he's neutered. Maybe not. So the aim of the study was to determine whether aggressive behavior toward familiar people, strangers, or other dogs was significantly different in dogs that were neutered at various ages versus intact dogs. So data for intact dogs were compared with those for dogs neutered at 6 months or less, 7 to 12 months, 11 to 18 months, and greater than 18 months. Neither neuter nor age at neuter showed an association with aggression toward familiar people or dogs. there was a significant increase in the odds of moderate or severe aggression toward strangers for all ages of neutered dogs compared with intact dogs. Huh, those intact boys might not be the ones we have to worry about. Dogs neutered at 7 to 12 months of age were 26% more likely to demonstrate aggression towards strangers. There is no evidence that neuter at any age alters aggressive behavior toward familiar people or dogs. There is only a minimal increase in aggression toward strangers. Given the increasing evidence of significant negative health effects of neuter, there's an urgent need to systematically examine other means of preventing unwanted procreation, such as vasectomy. Let's see here. Gonadectomy is widely used as a method to treat and prevent behavior problems, including problems related to aggression. At minimum, neutering is advocated as a way to make dogs better behaved companions. Major veterinary organizations, animal welfare groups, and shelter rescue organizations promote these ideas. Behavior problems, including aggression, are the most common reason that owners relinquish adult dogs to shelters and rescue groups. Relatively few published studies have specifically examined the effects of neuter on aggressive behavior in domestic dogs, and the few studies that have provide conflicting information. The first study to focus specifically on the effects of neuter on canine aggression demonstrated that the frequency and intensity of aggressive behavior in dogs that are neutered young was not significantly different from that of intact littermate controls. Let's see. All right, so it is worth noting that every prospective controlled study that examined the effects of neuter on the aggressive behavior of dogs demonstrated either no change in aggressive behavior or an increase in aggressive behavior after neuter. The board of directors of the Society for Theriogenology, which is reproduction, and the American College of Theriogenology recommend that neuter be decided on a case-by-case basis. So, the best option for your dog is going to depend on breed, lifestyle, age, whatever goes into making that decision. The bottom line is that this is not a one size fits all. It is, let's see, I'm in Ireland. I run a home daycare and boarding service. I'm finding the neutered males are picking on the males that are not neutered. See? Also, I advise my clients not to neuter their dogs, at least till they're fully grown, but vets here will chop them off as soon as they can. Geez, I thought they were better over there. Maybe Ireland doesn't follow what Sweden and Norway does. So tomorrow we're going to talk about the girl dogs. And we've got a lot of really good statistics out of Sweden, out of Norway, because most dogs are left intact. Absolutely, if you were going to spay and neuter, you want to wait until they are fully grown, particularly if you have a large breed dog, to help decrease the risk of some of these joint problems in particular. The cancers, what's the ideal age to where we get the full effects of, I mean, I don't think there is an ideal age for spay or neuter. I think if at all possible, we should leave them intact or consider looking at things for the males, like a vasectomy, where we are leaving those hormones intact. God didn't put them there with no reason. They're there because they serve a function. All the different parts of the body work together. And if you take out one part, the other parts kind of go, oh crap, what now? And particularly when we're seeing things like Addison's disease and hypothyroidism. So those are other glands in the body tanking because we took away one part of the glandular system. So for me, at this point, I have made the decision to keep my male dogs intact unless they come to me already without pieces. First of all, I'm a responsible owner and I have small passive cavaliers, although I'm not sure that we can call Forrest passive. He's kind of a wild card. I only have one female and she is spayed. She was spayed at the age of 4. There's no risk of accidental breeding in my household. And while everyone believes that neutering will magically fix behavior problems, it could actually make them worse. The only concern that I guess I might have is maybe testicular cancer later on with him, but that's an easy fix, really. And it's not a cancer that is aggressive like osteosarcoma, lymphosarcoma, hemangiosarcoma. And he's a small breed dog, so I probably have less problem with those. But I prefer leaving my boys intact. It is the right decision for me for right now at this point in my life. Would it have been the right decision for my entire life? I don't know, but I didn't know then what I know now. And knowing what I know now, I think that the more body parts we leave on our dogs, the better off for their overall health. It's there for a reason. And there's a lot more to it than just reproductive reasons. All right. So talk to your veterinarians. Tell them there are other options. Marlo, Gwen's big dog, is going to have a vasectomy on Valentine's Day. I think that's very fitting. He is scheduled for Valentine's Day. And by the way, this will be our veterinarian's first time performing a vasectomy. You know what? She was open to it. We asked for it. We said, would you learn how to do this procedure? We are willing to use this dog as the experiment. And I totally trust her. She's a good surgeon. She's been studying it. She's been learning the procedure by watching videos. And worst case scenario, we have all agreed, worst case scenario, if something doesn't go as planned, he'll get a traditional castration. So, which is not ideal in our minds, but we need veterinarians to learn this procedure and we need it to become more common. And I will quickly mention the other method of neutering that I didn't talk about because I am really not a fan, and that is the chemical sterilization where they inject, I believe it's a zinc compound, into the scrotum and the testes, basically to scar the testes. I don't know how much hormone that leaves in place. I know that it's incredibly painful, and it's being used in a lot of places, shelters that in dirty environments, without proper pain relief, and then they can get infected, they can get necrotic, and I'm just not a fan. I wrote about it in my first book, From Needles to Natural, way back in 2014. So not a fan, still not a fan. I haven't changed my mind on that, so I don't recommend chemical sterilization. All right, we are good. Do we have an outro? We do. All right, Instagram. Thanks for tuning in. See you tomorrow.